From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors. Friday morning, and it's a Cradle to Crayon show right here on Sunny 88.7 FM. We thank God Almighty for the gift of life. We are live on Facebook, our Cradle to Crayon Facebook page, Sunny FM Facebook, and also Sunny TV Facebook page. Also on Sunny TV, if you are home, just joining the discussion. Let's have an interesting time. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. In the course of the show, we'll open our phone lines. Now, pregnancy, as we all know, can be very exciting. It gets emotional sometimes. For some people, it's very overwhelming because they have a lot of unanswered questions. It's important that for every pregnant woman during your entire journey, you seek proper medical care. You know, have a proper antenatal care where they plan your nutritional, mental well-being. You're able to watch out for the signs that you need to come back, report to the clinic when something is going bad. Even have a delivery plan. This one I have here, midwife. Want to talk pregnancy plan with your midwife, pregnancy talk with your midwife, everything pregnancy. What do you want to know about your pregnancy from the time that your pregnancy test kit reads positive to when baby finally comes? What do you need to do? My midwife today is in the person of Thelma Kwashi. She's a certified midwife and a research coordinator, ONG Kolebu. Thelma, good morning. Good morning. It's good to have you here. And welcome to Cradle to Crayon show.
It's a pleasure.
Yes. So midwife, tell me, what does a midwife actually do? You also happen to be a research coordinator.
Yeah.
Hey, tell me, what do you do as a midwife? What's the work of a midwife?
Okay, so first and foremost, a midwife is a trained healthcare professional. They specialize in taking care of pregnant women through labor, delivery, and even after delivery. We mostly mainly take care of the mother throughout this process and ensure that they are healthy, baby is healthy, mother comes out healthy, and then the family is happy. And what I do as a research coordinator, we have a lot of researches ongoing in Kolebu Teaching Hospital, and it being a teaching hospital, we mostly have people coming in, with the various researches. And maternal health has a lot of research areas, because we have high levels of maternal morbidities. If I say morbidity, meaning a lot of mothers dying during during delivery, and then we want to find out the causes. And most of the time, when we find out those causes, that is how come we come up with researchers to make sure that we come up with answers. Then we would save mothers from dying, possibly.
Okay, so basically that's it.
Yes.
So they want to open our phone lines early so you can join the discussion. It's a pregnancy talk with your midwife. So whatever question you're expectant mother, you're a caregiver, a grandma who's your daughter, your nephew, your niece, someone is pregnant, you're home with her, you want some questions answered. Our phone lines have been open. It's 0540 130 684 0540 130 684. You can also drop us a WhatsApp message on the same number. My guest here will answer you. So Thelma, I want to find out, so antenatal, what actually is that?
So antenatal care is a care that is given to pregnant women, and we ensure that as mothers come in for this routine checkups, we ensure that the mother and then the baby is healthy. So antenatal care is very, very primary. It's one of the primary cares that a pregnant woman receives, so that we will be able to identify certain health conditions and possibly treat them before they become major complications. So it's one part of, it's a specialized care that is given. And then when mothers come in, it's amazing. It's really amazing. So when they come in, and then we are able to identify conditions that rise up in pregnancy, then we sort it out for the mothers.
When do you recommend that they come in?
The most important timing is the moment a woman realizes that she's pregnant. So when you take the test kit and realize that you are pregnant, that is when you're supposed to start antenatal. But all the same, maybe you didn't know that you weren't planning for pregnancy, and then you found out that you are pregnant. The moment you find out, you should come in for antenatal care.
Okay. So let's look at a typical first visit.
Okay.
She's done a pregnancy test. It's positive. Some still doubt. Hey, is it really positive? Then let me go to the clinic tomorrow. They come. What do you do typically? What routine? What do you do on the first visit?
Okay, so during the first visit, like you said, the patient had checked and then found out that she's pregnant. But when you come, we would reconfirm if truly there's a pregnancy there. And then when that is confirmed or determined, we go on to register the mother using an antenatal book. So every hospital in Ghana has this antenatal book. We will take the past history of the mother, if she had abortions, or if there were any complications during pregnancy, her previous pregnancies, and even if she's a first-time mother. So we'll take all that history. Then when we are done, we'll check the weights. We have the vital signs. We'll check the blood pressure, the temperature. Then we would also check mother's weight, and then the height. And then when we are done with that, we have routine infectious disease tests that we do. That is, we'll check if the mother has HIV, hepatitis B, syphilis, and would educate mother in case that some of the tests comes out positive. Sorry. Yeah. Then when we are done, we also draw blood to determine the mother's blood group. And we also do glucose tests and urine test. The urine test is to ensure that we don't have protein in the urine. So protein in urine is an indication for high blood pressure. Like there's a complication called preeclampsia. Yes, and when mother has protein in urine, there and then there are certain interventions
For
that
some,
can,
even on the first visit.
yes,
Okay.
it's determined.
Okay, I thought
So
when pregnancy is advanced.
sometimes it depends on when the
mother
let's say
turns up.
probably let's say it depends on the time that
Okay.
the mother
Okay.
turns up. And there are times too when during her previous pregnancy
Okay.
she had
Okay.
such complications. So such pregnancies are high risk pregnancies that need a lot of attention. So antenatal care in general like really helps the mother understand her state and then the baby's state as well. And then when we are done taking care of mother's general well-being, we go on to also check on the baby. So if especially when pregnancy had advanced, we'll check baby's heartbeat, we will check baby's position, if baby's lying in the right position, and then we would also determine the size of the tummy depending on when she comes in. Yeah. So these are some of the routine checks that are done at the first antenatal visit.
Do you do tests, lab reports,
Yes.
and all that?
Yes, please.
Okay.
Yeah.
How often do you schedule this? Do they come once you come on the first visit? They need to come the next month. How soon are you seeing them after that?
Okay, so when the pregnancy is early, we schedule the mother to come like every month. But when the pregnancy progresses into the last trimester, so let's say 36 weeks, 37 weeks, if the mother's pregnancy is not high risk, she can be scheduled for every 2 weeks till delivery. But if it's high risk, the mother would have to come every week till she delivers. So ideally, antenatal visits should be from at least 8. You have to have like 8 visits before
8
delivery.
visits. Okay.
Yes, please.
Okay. There are two things. Sometimes nausea and then even fatigue is something most pregnant women complain about. Usually, how do you help them manage that when the complaints like that come? How do you help them?
Okay, so we know nausea is the urge, like some
To
of the
vomit,
to vomit.
yeah.
Yes, and most of the time nausea has triggers. So some of our mothers, their triggers may be oily foods or spicy foods, and even some is because they eat at once, at a go. And some of our mothers too have this perception that they are eating for two, so they tend to eat a lot at a go, and it can also trigger nausea. And nausea predominantly is one of the experiences that happen during the early stages of the pregnancy. So it reduces over time during when the pregnancy is advancing. However, when you realize that you are vomiting excessively, because nausea is a trigger, you vomit or not. Yes, but when you realize that you are vomiting excessively, you become dizzy, you are dehydrated, you have to come to the hospital, because we call something hyperemesis. It's a condition where the mother vomits excessively, and it can be very fatal, especially if care is not given timely intervention. So with the nausea, you can drink more water and then just check out for your triggers. If you feel taking oily foods brings about the nausea, you'd reduce it, and then you put a stop to it. And you also space out your eating so that you will not have to feel that sensation. You can also take soda biscuits, or
those crackers.
Crackers. And then you can also take you can chew gum. And then fatigue happens in pregnancy a lot of the time, because right now your body is working for two. You are not just on your own like the usual you wake up in the morning, you are bubbly. Pregnancy is a unique journey. Every single pregnancy is different. So fatigue also attacks people, let me just put it that way, differently. Some of our mothers can sail through it and then not really feel like the fatigue. They're just fine. Yes. And then there are others too. It can really weigh down on you so much. So in times like that, we need a lot of support. That's where the support persons have to come in. You don't shout on her or just compare her to another person and say, this Ajwa was very okay. She was carrying firewood and stuff when she was pregnant, but you are always lazing about. No.
So this support, is it from you, the midwife, or from the partner at home, or the mother or the auntie at home?
We have an extent to which we can help, especially when the patient comes into the facility. But then the majority of the time, like their support persons, that their partners, their mothers, their sisters, or whoever is supporting them throughout the journey should be like very involved, because it can be it's a happy experience for some people, and it can also be a very sad experience because it takes an emotional toll on some of the mothers. And one thing some people don't know is the physiological changes that is happening because the hormones are up there.
They're all over the place.
Exactly. And then our mothers too, it's new to them, especially if she's a first time mother. It's new to her. She's trying to understand what is happening in her body, why she's behaving the way she's behaving. So when she has support, it goes a very long way to help.
Okay. The question I asked about the support, there are a few times when I've heard pregnant women complain about, hey, when I went, the way the nurse midwife spoke to me, she was shouting at me and she was that. So some people actually will come, and the way the relationship with them, sometimes I think they look at you and then they address you in the way that you appear. And you don't really talk to them well. You don't really address, you're not patient with them to explain things. Oh, konakoye we booking. How are we looking at that? Because if you're talking about support, that's both from your end and from the home as well.
Yes. Well, what I can say is that in every organization or institution, we indeed have bad nuts. But then again, we are trained professionals to care for pregnant women. We are there because we have to support them throughout their journey. So it's just a few people that actually act rude. I don't want to exclude them.
Okay.
It's just a few people, but we have very nice, amazing midwives who are very attentive to their clients. They even go outside their way to give their patients their numbers so that they can call us and when they have any question. So yes, we do have rude people, so to say, but then again, we have very amazing midwives as well.
Okay, very amazing midwives as well. It's just in 30 minutes at top of that. Javier Thelma Kwashi, the certified midwife and a research coordinator, ONG department. Colleague, we're discussing pregnancy talk with your midwife. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. Visit their center for all your fertility, maternal and general health concerns. Their services include IVF, and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, the surgical service, that's both general surgery and plastic surgery, theater service, and the laboratory and ultrasound scan services, amongst others. They are right here in Accra, Taifa. Call them on 0558 862 292 or 0592 196 003. Master Charlie's Hospital and Fertility Center, integrity and excellence in healthcare. Yes, like I said, our phone lines have been open. You can still make a call us. 0540 130 684. My guest here will answer. You can also drop us a question. So I want to find out, you mentioned food. What foods usually advise them? Healthy diet during their journey?
Okay, so we advise mothers to take a balanced diet. So fruits, vegetables, and then healthy meals, and then reduce the oil. So for the food, we can do more green leafy vegetables because most of our mothers need iron, and then those are very healthy source of ions for our blood formations. And then we also have fruits. You can eat every fruit. We have this misconceptions where some people are like, when you take in pineapple or pawpaw, it can cause miscarriage. There's no paper or research backing that.
Never heard of this.
Yeah. It's actually something that flies around a lot. So you can eat every fruit, you can eat everything in pregnancy, but then again in moderation. So if you enjoy your pineapple, go get it. If you enjoy your pawpaw, eat it, but don't be restricted to what people actually say concerning that. And then for drinks, please let's avoid alcohol intake and then drinks high in caffeine, because caffeine inhibits the absorption of iron. So if you are taking in a lot of caffeine, it would inhibit iron, and then when it inhibits iron in your body as a pregnant woman, you'll not be able to produce a lot of blood, and then blood is like the baby's life. Yes, so if because through blood crosses through baby's placenta and gives baby food, oxygen, and everything. So when a pregnant woman's blood levels have reduced, it's a really huge issue. So if you are taking a lot of caffeine, just know that you are going to stop blood formation in your body. And then alcohol can mess up the whole pregnancy. You may feel like you're taking alcohol, especially for maybe some people who want to potentially abort a baby. They may think if they take in excess alcohol, it may abort the baby. But then again, baby can come out very come like you carry the pregnancy to term, but baby will come out with malformations like certain deformities, and then you would have to live through with that. So let's also avoid alcohol intake. So these are some of the food and drinks that we should look at during pregnancy.
Okay, I think we're having problems with our phone line, so please send a voice note. I think a voice note to do. You can't pick the call 0540 130 684, or drop us a message on Facebook, whatever it is. My guest here will answer you. So you talked about taking pineapple that people are saying can. This myth, I don't think I've heard, but there's one I've heard about what they say that when the bump is high, is a girl, when it's low, is a boy. Are there others that you want to correct?
Yes, I would also want to correct a myth about cesarean section. Cesarean section is not a death sentence. It is just another form of delivery. So whenever you go to the hospital, your obstetrician sees, reviews your history and everything, and thinks that you need cesarean section. Don't shy away from it. Don't start going for prayer camps, and that may even end up being a testimony in church and all that. We have to understand that cesarean section is also another mode of delivery. So don't hold back. And then the doctor will not just recommend cesarean section because they want to do that. They look at your state, and then baby state, and then would want to introduce that. And another myth that some people also have is that when you have swollen feet and face, that means you are expecting a boy. So so some of our mothers will be so excited when they see such changes, but then it's an indication for a condition we call preeclampsia, which is a very, very fatal condition. So whenever you experience that, especially, it has this indication where when you press on your feet, it stays there, like it just leaves a dent. It doesn't come up. So when you see that, quickly rush to the hospital. And when you're having any form of issue with let's say blood vision, headaches, don't stay home. Come to the hospital. That is why we are there. We have a whole team. Yes, those are danger signs. So we look at those things and then also do timely interventions to save you and baby.
I'm sure in your years of practice, there have been instances where some pregnant woman never turned up during the time 9 months. You only see them on the day of delivery. I'm sure you've had.
Yes.
Why does that happen? Why don't they come?
Okay, for such mothers, there may be barriers. Some people, it may be because the hospital is far away from them.
Far away.
Yes, and others too.
Because in this day and age, there are lots of hospitals all over.
Yes, but some people just don't want to show up to the hospital at all. Yes, they just have this phobia for coming to hospitals. They feel like the doctors or midwives would diagnose them with some disease they don't know of yet, but when they come, there's always this new thing that the doctors or midwives would write about their condition. And some people also don't like the long waiting time, so they just avoid coming to the hospital. And one major thing that is missing is education, because most of our mothers still have this primitive mindset that when they don't even come to antenatal, they can birth a baby. Because most in the past, we had our great grandmothers going to farm and even delivering the baby in the farm. So they feel like they can actually go through pregnancy without having to come to the hospital. And some go through that. And then, every pregnancy, like I said earlier, is unique. So what Adjoa went through successfully and had a bouncing baby may be different from what a Kia may go through. So our mothers also have, like, we have to, a lot of education to do so that we can encourage them to be coming to the facility. And some of our mothers also, because they've given birth a lot, so some people have given birth to 9 children or 5.
So they have mastered the
They've
act.
mastered the act. So they are like, nah, I'll not come to the hospital at all. I know what to do. I know what to look out for. And because the pregnancy, every pregnancy, even with the mother, your pregnancy, your 3 children, you would have different experiences. Yes, and such pregnancies.
Okay, let's there's a question. Let's pick this.
Okay.
Hello, good morning.
Good
My
morning.
name is Chantal. I'm speaking from Sprinters.
Okay.
I've been listening to your conversation about pregnancy on Sunny Radio, and I would like to ask a question about when you are pregnant, you get swollen fits. Does it that determine that you are carrying a male child or a female child? And second, too, sometimes too, you vomit blood. Not almost, but sometimes. What causes that? And every morning, so I know a friend who every morning she vomits a yellowish fluid. Yes, and her stomach itches her, so she use her finger to scrub her tummy. Is it good to scrub the tummy? Yes, when you are pregnant and early morning, like I said, you vomit yellowish fluid. Is it advisable? Yes, and being pregnancy for 10 or more, is it good, or is a complication that make you go through that, or something that causes it? Thank you so much. Have a nice day. Bye.
Okay. Thank you so much. So Thelma.
Okay, so I'll tackle the first question, which is actually a myth.
Yes.
So when you have swollen feet, like I said earlier, it's an indication for high blood pressure, and that's you are nearing something we call preeclampsia, and that state is very fatal. Means your blood levels are high, you're at risk of kidney failure, like your whole body can even shut down. So when you have such swollen feet, swollen face, don't wait at home at all. Come to the nearest facility, and especially a hospital where they can treat emergencies, because some of the hospitals around us are maybe maternal health centers, or go to like a hospital like, let's say, Kolebu or Rage Hospital, and make sure that you are taken care of. You'll be taken care of. And secondly, about the vomiting, I would like to know if it's excessive, because as I said earlier, nausea is one of the feelings that you have during it's not every woman that actually experiences it, but then again, during your first trimester, you would have that experience with a yellowish fluid. Stomach produces acids, so sometimes even with normal people, when you like sort of brush your teeth too much,
Yes, you
you throw up, and sometimes you throw up those yellowish fluids. It doesn't mean there's something wrong with you, but then when you realize that like the vomit is more excessive, you have to come to the facility, because it may make you dehydrated, and then that could also be fatal.
Okay.
Yes.
Talk about the scratching of the
The scratching, it depends on what, maybe she's having allergies. It could be some
maybe.
allergy. Yes,
Okay.
so she has to also come to the hospital, but that will not impact the pregnancy or cause a miscarriage or
It will not affect
baby.
it
It
in
will not
any way.
affect baby. Or some people have the misconception that when you scratch your stomach or there's a mark on you,
it becomes dry sometimes.
Yes. But that doesn't mean baby will come out with marks and all that on the body. No.
Okay.
Yes,
Our time is up already. I want to find out a research coordinator here,
Yes,
midwife.
please. Yeah.
My concern is for those who are not turning up for antenatal and come on the last day.
Okay.
I'm sure. I mean, it's in Accra. I'm sure we're having lots of the people, but those in the rural areas, more of them are not turning up. They stay home, like you have said. They are skilled in it, so they'll stay home and have their babies. What is being done about it? How are we getting the women, convincing them that this is key? You need to turn up when you are pregnant.
Okay, so first and foremost is education. We sensitize the women, and for the ones that live in the rural areas who don't have easy access to healthcare, midwives and nurses and even doctors are dispatched to their various communities, and then they will go from house to house to check on mother and check on baby. That is one thing that we do. But then again,
You're
like
taking
then-
the care to them in their
yes,
homes.
we take the care to them in their
Okay.
homes, and then by so doing we encourage them, because you mentioned that some people are rude to the
Yeah.
mothers, so
Yeah.
some also have that in mind that, okay, fine, I've not come for antenatal for a very long time, if I show up I'll be trashed. So when we take the care to them at home during home visits and all, it also gives them the hope that when they come they'll be treated very well. Yes, so that is some of the things we do.
Okay, time. So thank you so much, Thelma. We'd love to have you here. And then thank you to the guys here. Thank you. Don't forget, same time tomorrow morning, 9:30, repeat broadcast on Sunny TV. Have a good working day. Thank you to my sponsor, Back Specialist Hospital and Fertility Center. Have a good working day all, and stay blessed. Bye-bye.
From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children.